Info Ninja. Welcome back to the JoJo, everybody. Thank you for joining me. Hope you took a second to pause over the weekend and say thank you on Memorial Day weekend for the people, not to the people because they've passed away, but for the people who gave up their life for our freedom in this country. God bless you, God bless your families, and God bless everybody that's in the active duty military right now. We wouldn't have our freedom if it wasn't for you.
That's right!
So, on Tuesday, yesterday, the CDC and one of my favorite people now, Mr. RFK, baby, Bobby Kennedy, made an announcement related to the COVID vaccine. So if you haven't been listening to this show for the last 4 or 5 years, you may not know that I despise the COVID vaccine. I despise the fact that some people were quote unquote forced to take it, but I also despise the fact that it was a big cash grab for the pharmaceutical companies. I despise the fact that it actually killed people. Remember, that's just a conspiracy, right? But every day that passes, every month that goes by, every year that goes by, we start to learn more and more about the effects of this vaccine. And yes, it was killing people. Yes, it was producing myocarditis. I'm probably pronouncing that wrong. Yes, it was making these little weird things that they were finding in people's veins where when they would die, maybe from COVID, maybe from the vaccine, maybe from a car accident, but they're trying to get embalming fluid through their systems, and they can't get it through the veins because of these clots that are in the veins, and they appear with people who have been vaccinated with the COVID vaccine. And remember, this was all conspiracy. We were crazy for bringing this up. We're misinformation. We're going to kill people. And as it turns out, no, the information that we were giving was probably saving people's lives. When I was telling you not to take the COVID vaccine, I was saving your life versus telling you to take the COVID vaccine and jump on the train with everybody else. Now you got a lot of people out there that probably have a ton of vaccine hesitancy because of it, but they have a lot of vaccine regret, buyer's remorse. There are some people walking around right now knowing they got forced into taking this vaccine, and they can feel it just floating around in their veins and in their system, and it's kind of nasty. So the CDC finally announced that if you are a pregnant woman, you no longer need that shot. They're not recommending it, or if you're a healthy child, they're not recommending you get the shot. I'm recommending, and I'm not a doctor, that nobody gets the shot. Healthy or unhealthy, pregnant or not pregnant, nobody should take this poison and put it in their veins. You have some Jesus antibodies, God-made antibodies that will come if you're infected with COVID, and your body will fight it off unless you stick a bunch of chemical and crap, who knows what's in that vaccine, inside your body. So they announced this on Tuesday, and then right on time, folks, and this is the purpose of today's episode, is almost like theater. Right on cue, we have a new COVID virus strain. What are the chances that they're starting to rule out and get rid of the vaccine everywhere? The pharmaceutical companies are going to lose their cash cow, and right on cue, perfect timing, we have a new COVID strain from China. That's right, China. You know, we were blaming China for the lab leak, and it turns out that we should have maybe been blaming China and ourselves, because the more and more we learn about gain-of-function research and Dr. Fauci, the more and more we're learning that we were kind of partnered with them in this entire process. But that's for a different episode. This one comes to us from the New York Post. The headline is, highly infectious new COVID strain from China that led to massive spike in hospitalizations. Guess what? Has spread to the U.S., including New York City. I wondered why they put a little tag on the end of that and said including New York City, because when you say it has spread to the U.S., you would assume, okay, New York is in the U.S., but New York is one of those melting pot hubs where if you're gonna drop a virus and you want it to spread around the world and spread around this country, you started off in New York because everybody is going and coming from there that does business, and it's a good way to get an infection spread around. So the article says a new highly infectious COVID-19 strain that has led to a spike in hospitalizations in China has now been detected in the U.S., including cases in New York City, according according to the Center for Disease Control and Prevention. The new variant is called NB.1.81. NB.1.81. That name is lame. It's not nearly as cool as Omicron. So, since it's NB, I'm going to call it Naughty Boy. But it won't be as cool if we call it like Naughty Boy. Since Naughty Boy is kind of one of those, like, I don't know, it doesn't sound tough to me. You're a naughty boy. We're going to say it like this. You naughty boy. So, let's go on here. So, the new Naughty Boy variant was first detected in the U.S. in late March and early April among international travelers arriving at airports in California, go figure, Washington State, Virginia, New York City, and additional cases were also reported in Ohio, Rhode Island, and Hawaii. The CDC has said that there are too few cases at this time in the U.S. to be properly tracked in the agency's variant estimates, but experts are warning that the virus's run in China shows it spread more quickly than other dominant strains of the respiratory infection. So apparently, it's going to kind of be like Omicron in the sense that it was easily transmitted. It was easy to get that infection to go around the country faster. So just what we needed, just on time, just on cue for when we're getting rid of the COVID vaccination. So it says experts have been closely tracking Naughty Boy variant after it became the dominant strain in China this year, which caused surges across Asia. Hong Kong authorities say COVID-19 cases have spiked to the worst levels in at least a year after officials announced a significant increase in emergency room visits and hospitalizations in the last month due to the new variant. That included 81 severe cases in the past 4 weeks that included 30 deaths. What is the math on that? 81 cases and 30 of those people died. That's not quite a 50% mortality rate, but it's in the 30s. It says the vast majority of those cases, however, were adults 65 and up. So it looks like old school COVID, how it liked to kill fat people and sick people and old people. So in mainland China, the portion of patients going to the ER with COVID has more than doubled in the last month, from 7.5% to more than 16%. Is that still happening here in the United States, folks? Are people still going to the hospital in the United States with COVID? It's happening in China, and I always see everybody, everywhere they go there, wearing masks in the videos and pictures from China. So apparently, masks don't work, folks. Take them off in China. Take them off here in the States. Well, we took them off a while ago. But there are still some people, and you could see them out there, wearing their masks. Essentially, they are just virtue signaling 3 things if they wear their mask. 1, they're a Democrat. 2, they're mentally ill. 3, they're assholes.
No offense, but you are a stupid asshole.
It goes on to say that despite the stats, the Beijing-controlled government in Hong Kong downplayed the variant and said it does not appear to be more dangerous than the previous variants. What we're seeing in China, Hong Kong, and some other areas where the variant has really surged is an increase in hospitalizations. Dr. Amy Edwards, a professor of pediatrics at Case Western Reserve University Medical School, told CBS. Well, thank you, Dr. Obvious. You just reported what the Chinese government has already reported, that yes, this new strain is causing an increase in hospitalization. She must be a blast at parties, Dr. Amy. You say something to her and then she just repeats it back to you like it's new information. I'm sure she's lots of fun. So the CDC airport test revealed the extent of the virus's spread in travelers who were infected with the variant traveled through China, Japan, South Korea, France, Thailand, the Netherlands, Spain, Vietnam, and Taiwan. Like other forms of COVID-19, the variant can cause coughing, a sore throat, fever, and fatigue. So really not that bad if you're a healthy person in good shape, but maybe if you're not healthy, if you're old, if you're fat, if you're sick, maybe it might be a bad one for you. Subhash Verma, a professor of microbiology and immunology, I can't talk today, folks, I apologize, at the University of Nevada, however, noted that the new variant appears to have a growth advantage, suggesting it may spread more easily. In other words, it is more transmittable. Well, thanks again, Dr. Obvious number 2. You're just reporting what the Chinese government has already told us, that this one appears to just be more easily spread. These doctors, they are just the life of the party. Now, Dr. Edwin Tsu, the head of Hong Kong Center for Health Protection, said that the new variant should not be taken lightly. That's lightly in Chinese. They mix their R's and their L's. He warned that Chinese health officials and others around the world that the evidence suggests the virus may have evolved to even further evade the protections of the COVID-19 vaccines. What protections are you talking about, Dr. Tusi? What did the COVID vaccine ever do? It didn't stop the spread, it didn't stop you from getting COVID, and it didn't stop you from being hospitalized. So explain to me what protections this new version of COVID, naughty boy, is evading. It makes no sense. I already don't trust this guy because of that.
He's an asshole, sir.
I know that. What's his name?
That is his name, sir. Asshole. Major asshole.
So the article just goes on to tell us more about this new strain and where it's spreading and what we might be able to expect. And ultimately the answer is they don't know. They don't know what to expect. They didn't know anything last time. Remember when they told us 6 feet and then it turns out that they just kind of made that number up? Remember when they told us to wear a mask and it would prevent the spread and then it turns out they were just kind of making that one up too? I don't trust any of these folks. Don't get their vaccine. Don't get scared about any new naughty boy strain that you might hear about on TV. Don't get sucked into it this time, folks. You need to get sucked in to your Bible. You need to get sucked into a relationship with Jesus. And then you're not going to worry about anything except making him happy. Hi-yow! Info Ninja. If you liked what you heard, please give me a thumbs up, a comment, and a share. You can find us on X at Info Ninja Show, on Rumble, Truth Social, YouTube, and of course, anywhere podcasts are sold.